The predicted fall surge of COVID-19 is here. Rising cases across the U.S. appear to bear that out. The U.S. is averaging 55,000 new cases a day. 10 states reported their highest single-day cases count. Florida reports more than 2,000 cases a day for almost a week running. That's a 10% increase. Tally it all up, and you'll see there are more than 8.5 million cases and 220,119 coronavirus deaths in the U.S., according to the data from Johns Hopkins University. Dr. Jonathan Kantor, an epidemiologist with the Penn Center for Epidemiology, joins us once again here on the morning show. Now, no one is saying shut down, but Dr. Anthony Fauci is saying that we have to be mindful of public health measures or things are going to get out of control here in Florida like they are in some places in the Midwest.
Yeah, I think we've seen that already in Florida. I mean, we already went through a situation where, we all kind of felt this great sense of relief. We felt like the restrictions were lifted. And the result of that, unfortunately, was that we saw a really dramatic increase in cases. And I think the problem is that we can't just be complacent and say, you know what, we're in the South. It's not the same, because we learned over the summer that weather is not really predictive. It's not really protective either. What really is going on is that it's the people who are up north now. They're inside more, they're going to be sniffling more, they're going to be touching surfaces. And unfortunately, that's the same trend that we tend to see in North Florida as well. In Northeast Florida, we do see people spend more and more time indoors as the fall wears on and as we get into winter. And then I worry that we are potentially going to see the same situation here as well.
You think that one problem is people are suffering from what Alex Azar, the Health and Human Services Secretary, calls mitigation fatigue?
Yeah, absolutely. I mean, I think, whether you call it mitigation fatigue or pandemic fatigue or just, pandemic, it's just too much. And I think people really are getting tired. You had some people who basically after 24 hours, I think they were feeling pandemic fatigue, back in like March when there were some restrictions that were placed. I think some people felt immediately like it was too much. But I think even those who felt really conscientious and even those who kind of felt like, you know what, we're going to take this one for the team. We're going to kind of do our patriotic duty. We're going to try to, limit our activities. We're going to try to do social distancing. After 6, 7, 8 months, that gets very, very, very tiring. And it gets tiring on individuals. It gets tiring on families. It gets tiring on communities. And so I think we need to start thinking about creative ways in which we can kind of continue this and keep it moving forward. And so that we continue with a sense of mission and that we don't all succumb to this, this fatigue at this point.
Several things causing the spread. Big events where people gather with no masks, no social distancing, jammed political rallies, and politicians saying we're turning the corner and no need to wear masks. Any reason to believe we might be turning the corner?
No, I don't think we're turning the corner. I think we are far too early in this. I mean, I love a sense of optimism, right? I always love the idea that we think we're all going to, we're going to do well and that we're almost there and it's just a little further. And, the UK actually had a government policy on this because they were trying to avoid the pandemic fatigue that we were just talking about. And so they were trying to kind of incrementally roll out restrictions and incrementally pull things back because they thought it would encourage people to do the right thing. So insofar that we think it might encourage people to do the right thing, I understand the need for messaging in all sorts of different directions. At the same time, I think it's very important that, that we are realistic in terms of our expectations and we are realistic in terms of how long this is going to go on. And we're realistic in terms of what sacrifices we need to make as individuals and as communities for the greater good.
And two epidemiologists believe that the Sturgis motorcycle rally in the Dakotas may have been responsible for a lot of that spread in the Midwest. But this is interesting. Small family gatherings may also be fueling a lot of the spread.
Yeah, I think, there are a lot of different ways in which, we're seeing the spread occur. Remember, this virus is a little bit sneaky and it tends to actually spread pretty efficiently. Certainly not as efficiently as the things we really worry about, things like measles and of that sort, but definitely it tends to spread more efficiently than we would like. And so I think definitely even small family events, and I'm not talking about, events with you and your household, but, rather if you have your cousins come over and extended family, those are definitely opportunities opportunities for infection. And I think it's really, really important to keep that in mind. The same thing occurs really in restaurants. That is sort of one of the the unspoken areas of transmission. But in speaking with some of the people from the state last week, that is definitely a concern because, again, it's somewhere where people are literally letting their guard down. They're taking their masks down. They're touching things in common. They're putting things to their mouth. And those are all areas where you really run the risk of potentially increasing the risk of transmission.
That's perhaps why scientists are saying the worst is yet to come in the next 6 to 12 weeks with Thanksgiving, Hanukkah, and Christmas just on the horizon. Dr. Kantor, always good to talk to you.